Your liver has a secret superpower. It can regrow, it can regenerate. And yet, HCC or liver cancer is one of the top 5 cancers in India. Ironic? A little. Most people for a very long time thought surgery or chemotherapy were the only options. In 2026, that is old news. HCC is the most common primary liver cancer. It loves a cirrhotic liver, hepatitis B, hepatitis C, and it also loves a person who has had a little too much fun for a few decades. Now here's the thing, a person with HCC generally has a very sick liver to begin with, and you cannot just waltz in with the scalpel in such a patient. Here is where interventional radiology enters the chat. So the first option is something called as Transarterial Chemoembolization or TACE. So here we take a small access through your wrist or groin, and then a tiny tube called catheter is navigated into the blood supply supplying your liver, and then we inject chemotherapeutic agents directly into the tumor, and eventually we block off the arteries supplying your tumor. So it is basically a siege. The second option is something called as Y90 Radioembolization or TARE. So here microscopic beads containing radiation is injected directly into the tumor, and this will kill the tumor. So this is supplying radiation into the tumor from inside like a Trojan horse. No surgery, no general anesthesia, back home in 24 hours. And the third and final option is something called as radiofrequency ablation or microwave ablation. These are applicable only for small tumors, and this is also a daycare procedure. Patient can walk in and walk out the same day, no hassles at all. So to our gastro, onco and surgical colleagues watching this, every BCLC stage from 0 to C except D as a minimally invasive therapeutic option. Our patients deserve an IR opinion. So let's plan together.